Hi, how are you? Hi, friendly. Oh, hi. How's
There's
everybody? How are you? So everybody needs both their vaccines, right?
Yes.
Darren is one of my faves. I don't see him that often because he's, fairly off the grid, but, he's always taken in, wayward souls, different dogs. He's just a kind guy, and I really enjoy working with him.
He has an ear issue.
I see that. He does have a chronic ear infection. Yeah, okay, hold on now.
Okay, buddy.
Hold on now. Have you ever done any antibiotics or anything in it?
No.
It's starting to look like you should. If you look here, you can see all the dark debris. That dark stuff is often kind of yeasty goo, but when it gets to this point, it's often a mixed infection of yeast and bacteria.
Mm.
Likely it's gone beyond just being a little bit of a yeasty infection. May even have progressed into the middle ear, I'm not sure yet.
If left untreated, an infection in the middle or inner ear could lead to permanent deafness, and in extreme cases, facial paralysis.
What I'm gonna do is just flush out all that yucky debris, make it nice and clean, and then get in there with some of the anti-inflammatories, antibiotics, and antifungal.
Thankfully, Michelle always comes prepared for the unexpected.
Even if I'm just popping out for vaccines, I have to have the whole suite of emergency. Like some dogs react to vaccines and you have allergic reactions. I have to be prepared for that. Happen to have one last ear antibiotic treatment, thank goodness. Okie dokie.
Come, buddy, come.
Okay, bud. Okay, so if you can kind of try and pin his head a bit. I can even see in there. Yeah.
Good boy,
It's an abyss of yeasty, waxy goo. What I really want to look for is make sure his eardrum is intact.
Mm-hmm.
So I do see his eardrum, goo around it. I'm gonna flush it a bit with this first, just because all that gunk will just bind up the medication. It won't really work. So let's see if we can get a good flush in here, and that'll just help kind of break everything up. Ooh, that's what the sound you want to hear. Look at his little, look at his foot go. Yeah, just gonna try and soak a bit of that up. That's a good boy.
That looks much nicer.
Already it looks better. Smells nice. So what you do is, their canal is kind of down here, down at the base there, and goes that way. So I just put that in that direction, give it a squish.
Thank you so much, Michelle.
Hey, no problem.
Well, I can let the hounds go.
Yeah, release the
Puppy,
hounds.
you can all go for a run. Good.
All right, thanks again.
Thanks, Michelle.
Take care.